Thank you, Julie, and thank you for everyone for being here virtually. I think last time when we ran this event, we called it Pitching Your Innovation to Healthcare, and Bobby and I did it live at the ULP Center, and we were joined by Dr. Talmichenko back then, so the three of us ran it live. It was a lot of fun to actually have the real interaction. So thank you for giving you a chance doing it virtually. We're excited to at least be able to communicate with you this way. Again, as Julie said, I'm one of the consultants on the team at SBDC at UCI Beall Innovation, working with startups. A lot of them are healthcare, a lot of them are tech. And I would like to introduce Bobby Shah. We've known each other for a long time, and I will let Bobby talk about his background, but just to give you the highlights, I mean, he was an entrepreneur himself as well as an investor, so we'll tap into both sides of his brain for feedback today and for insights. Bobby?
Thank you very much, and thank you for this opportunity to be here. My background, I really got into healthcare about 2 decades ago. Mostly because of a close personal individual that had a very traumatic event. And I think, you know, once when you get into healthcare, if it's passion driven and you feel the pain, you won't know pain. Co-founded 2 companies. First, we invented a syringe for epidurals called EpiSure. The second one is a family of infusion pumps called the AccuFlow. And that one we grew in 42 months to 3 people, to over 100 staff and 3 offices, and that one exited in June 2013. Since then, been an investor, sit on some boards of some companies. Really, my main strength is taking a idea, taking it all the way through to actually a product and go to market, and how do you build a company and not wait 7 years to deploy a product, which is what's industry norm. So thank you, that's just a short blurb about myself. Thank you.
Yeah, so today we wanted to keep the conversation informal as much as we can. So one thing we wanted to do, Bobby and I talked about allowing the audience, if those who want to pitch their ideas in healthcare, we'll open mics and we'll do a 60-second pitch if some of you wish to do so. Just to let know in the chat box that you want to do it. Then at some point we'll raise your hand, we'll open up mics, and you can do the pitch and sort of ask questions around that product. So for those of you who attended our previous live session, we talked about pitching innovation into healthcare. So I don't know how many of you attended that event. So we wanted to do just a quick recap. You know, what we talked about then was that innovation really falls into 3 major buckets. You can slice and dice it anyway, but that's one way to do it, is clinical innovations, which will include devices, drugs, apps. Operational and financial bucket, which would be the workflow. That's where cybersecurity lives, infrastructure, billing, audits, new revenue streams where you can partner up with the hospital system to increase their revenue streams, and patient experience. So and most of you are doing innovation in healthcare, so we're assuming that most of you are startups. So this is not selling an established product that was around for many years. It is sort of innovating and then selling to healthcare. And the major takeaway that we tried to instill last time is, one way to approach it is you need to research if health systems have innovation centers. And how do they approach innovation? What type of innovation centers they have? Some have internal innovation centers, some have external, where they invest in startups, either in kind or with actual grants. And knowing whom to approach really helps. So your innovation center is the first place to go. Right now, they're very prevalent. It was probably not the case, Bobby, when you were first starting up, correct? Oops, you're muted.
Yeah. No, absolutely correct. You know, it was a traditional model, the way things have been done for 2 decades. Doing anything different, people look to you very weirdly.
Yeah, and so more and more, like chief innovation officer was not a position that was ever present on anywhere in the hospital. Right now, you're probably hard pressed not to find some kind of an innovation center at a system. So approaching the innovation systems is one way to get into the system where you can do your customer discovery, start the process, because selling starts from day one. And it doesn't matter which way you go, even if you go for non-diluted funding, like STTR grants, for example, NSF, NIH, they want to know what have you done as far as customer discovery, what the real need is, and they want you to write about the commercialization plan. So one of the ways to do it is being sort of smack in the middle of the hospital. And Bobby, you were working in the hospital when you were developing both the syringe and the pump, right?
Correct. I mean, our main thing was, I'd always have an engineer with me. We were speaking to physicians on a regular basis. We literally walk the halls. And it was a matter of ensuring that the user was continuously engaged right from the initial drawing phase. And that was very important. Last thing that we wanted was, which happens majority of the time, you develop a product, you go find a key opinion leader, and you say, please use this. This looks great. And it's frustrating. There's no input from them, and you really have to have that engagement from early on, all throughout the process. It's very important.
And a lot of times, so I just want to give an example. For example, when you're submitting your proposal for, let's say, NSF, they're especially strong on commercialization part, and they're looking for letters of support. Some of you may not realize that what they're really looking for is the identification of need. They don't even want to have that key opinion leader tell them that they will buy your device. What they want to hear is they know they have that problem and they want it solved. And you're pitching your idea that your solution will fit perfectly for them. But they're really looking for that pain in the market, and you can't get it unless you're in the middle of it and have a champion on the ground. So Bobby, I wanted to ask you if we can compare maybe and contrast, because you started years ago where it was sort of a little bit more of a traditional way, and currently you are a CEO of DocBox, and you're on the ground, so you're sort of back, instead of just investing only, you're back to actually having to sell. It is a pain. It is also exhilarating, but can you talk about the differences that you're seeing on the ground, and talk a little bit before what the company is, what DocBox does, so everyone has some kind of a perspective, because it's different. You had a clinical medical device as opposed to now you have something that is more lives in the IT realm to a certain degree.
Correct. So previously, it's a product, right? It's something you could touch, something you could feel. There was a need for it. I firsthand saw the problem, spoke to multiple physicians. How do you automate a process? And I think the key aspect here is even let's call it pre-COVID, because everything is different. I mean, this is a new world. It really is, from development through to go to market. So previously, how do we automate a process? How do we make the user's life a lot easier? How do we reduce the learning curve, improve that quality of care, improve the throughput? And that really is that golden triangle that we looked at. And we did that through innovation. Moving on from hardware to now really what it is a data-driven company. And what DocBox does today is the bedside unit. It is in the ICU, so it has an ecosystem. COVID really has brought about how do you maintain the quality of care irrespective of the location of the patient, irrespective of the infrastructure that a hospital can provide you today, and irrespective whether you are a tier 1, tier 2, tier 3 system. And that is a problem that's happening globally. And that's what this company does. It's a bedside unit, pulls in multiple data from multiple devices, collects 2 to 3 gigabytes of patient data per day, per bed, but also allows for you to monitor. And what they're launching actually is where you're able to monitor at home. So you're able to have sensors, which will be available in general stores. You can monitor back into the HIS system, into the EHR, and it provides a value add in the existing hospital EHR today. And you know, what is everyone looking? In the US, you're actually experiencing what's happened in the third world in the last 30 to 40 years, where you're trying to have one physician monitor up to 1,000 patients. And that's the single line that's trying to be achieved in most countries right now. And that's really what DocBox does. So it's a platform, sits in the hospital. It's like an operating system of the hospital. Third parties can create apps that actually sit on the platform. The company came out of NIH and Department of Defense. So it is an open platform, not an open source, but an open platform, a bi-directional open platform. So this allows third parties to have apps that layer on top of this share of information. That share of information, you can build sophisticated algorithm AI machine learning. And through the partnership that this company has, both with the FDA and with the government, it allows commercialization, it allows a path to regulatory, and also through the platform, a path for deployment and revenue. So think of the iPhone. I mean, it's that operating system where you've got apps like Uber. You know, Uber wouldn't be here today if it wasn't for that operating system that the iPhone provided, that Apple provided, and that's exactly what DocBox is doing. So it's allowing these algorithms internally from institutions, individuals, and corporates to be developed.
Bobby, can you talk a little bit about the difference in how you were selling the product back then and how you're selling it now? And again, DocBox started before COVID, so the selling process, so to speak, happened before that. But then now you are working on installations in different systems. Yeah. And maybe touch upon the Indian connection as well, because that was one of the paths to sort of going commercial.
Yeah, so prior to COVID, my earlier companies, I was that guy. You know, we wrote the 510K and CE mark ourselves. We got rejected 20, 30 times. We were persistent to understand. We grew, we built products ourselves. We built a clean room. And before I really hired a salesperson, I wanted to know all the problems. So I literally got in the car and I drove, realized that there are protocols when you enter a hospital. You need to follow those protocols. You need to understand them. You can easily get blacklisted if you don't follow protocols. And how do you really understand what's the pathway to get into decision makers? And then, as you know, there are multiple decision makers. You've got clinical value, you've got operational value, and then you've got the logistics around this. And it really is about understanding and maneuvering. And it was about getting into those areas. And the clear thing is understanding your audience. You know, what is the pain point you're here? The worst thing they want is someone coming in and just selling and saying, please buy this, you know, it's the cheapest product, this is what it does. No, no one wants to hear that. They all really understand that you know what the pain point is. You're here to address it, you know, and you're here to provide that advantage. But also, not that I am going to be doing this, is look, this is the timeline of what we're able to do right now. The product has iterations. This is where it is in the future. It was a long, long road. I mean, it was painful. And I was consistently raising money to build sales teams. And then when you're raising money to do that, well, how many people, you know, what's your sales? Well, I need sales to build a sales team. So I'm on the road. You know, you've got 5 big states. That's 5 sales team. That's $1 million you needed just in the first year just to get your product to market. So data shows previously, for a medical device, it takes 7 years to take a product to market from the time that you have the idea. And it costs, irrespective of the development of the product, about $500,000 just by the time you take that product into a decision maker's hands to take a look. You know, and the time period by the time you go through that. So that's what the industry has been like for years, and it hadn't changed. And then the question is, you know, when you're in front of them, is the same question. Is this a product instead of something else? You know, am I buying this in addition to something else? You know, what's going to be the financial impact? I'm the physician, I may like it, but what's going to be for my financial team? And these were the things that took me years to even get my first PO and really understand the market. And then by the time I got the product in there, what I realized was that's actually not how they use it. They don't use it as a single product. They use it part of a family of products, which I now need to understand of how to get in there. So, you know,
it was a, I think if I remember correctly, it was a syringe, and then you realize that syringe comes in a tray, so you can't actually sell a syringe by itself.
spot on. We invented a syringe, but the way they bought it was in an epidural tray. I needed a needle, I needed a catheter, I needed lidocaine or epinephrine, and these are the things that we didn't do. So then we had to go out and find partnerships with these organizations, and that's really, you know, how we grew and how we understood the business. It really didn't start to take off. You know, we didn't really get our first PO until I think about year 4, because pivot, understand, pivot, rejection, and that's how it was. And then when you got to a physician, you say, would you mind please making an introduction to someone else? And that's that bottom-up approach. You know, you keep going door to door to door to door, especially with someone that doesn't have credibility. We didn't have a reputation. No one knew us as individuals. All we had was passion, drive, and we never gave up.
Did you consider ever using GPO, global purchasing organizations, and trying to get in that way, or was it just a financial decision that it didn't make sense as far as margins, and they would not really push your product because it was not high margin product for them?
Our first strategy go to market was, let's develop this. Let's find a big partner like a GPO, and we just have to supply them. That was our first strategy, and we got to a sense of realization very, very quickly. When we realized that, number one, they didn't really look at us because we were too small. We didn't have a track record. We weren't in the hospitals. So at that time, we weren't being looked at. As well as that, you know, there's an admin fee we have to pay. We need to justify. We didn't have economies of scale, so our margins were very thin. Our cost of goods were very high. And then even having a GPO made us realize as a board and as investors and team that gets you on a contract, but it doesn't get you revenue. Because at the same time, you are one of multiple products in a suite. So you still have to go and you still have to create marketing, still got to create brand awareness, corporate identity. You still got to get your product out there. You still got to generate the sales. And the thing is, when you get to the door, you can then say, by the way, you can buy it because I'm on a GPO. And then they say, okay, this is the pricing. So, I mean, our experience, and this is just us, you know, it wasn't the ability of us to where we can really control our own destiny. And that's what we were really trying to do, was really understand it. And then, you know, we made mistakes. So part of my mission in life is, please don't make some of the mistakes I made. Don't spend some of the places that I spent the money in. How can we streamline the process? You know, and I saw companies, great products, never got to market. I saw people that I know very well in large companies that would ask the question, okay, how many sales have you got? Well, you know, I'm still trying to generate that. That's not my core strength. My strength is developing the product I know the need. I need to go hire a sales team. And, you know, it got to that chicken and egg scenario, but 90% of those companies really didn't go anywhere.
The partners you used for the when you were putting together the tray, those were also independent companies that had their own sales force, correct?
Yeah, we went then. So then our next route was, let's use independent sales reps. Independent sales reps sell your product plus other products. Now the independent sales rep route, you know, it's great. They're independent, but you've got to get them on board. You've got to make them believers, because they have a suite of products, and you've got to ask yourself the question, is your product the carrot? What that means is that gets them in the door to their customer. Are you the most, you know, are you the product that's giving them the biggest revenue in their portfolio of products? Or are you the one that's the door opener in the product? And you've got to really understand where you fit in that. Where is your product? Because great, your product might be the shiny object, but it may not be the one that gets to sell because it's got the lower margin, or it doesn't really have a huge clinical impact, and you can't demonstrate what the economic impact is of your product because the information is just not there. It's just not strong enough. And that's where you have to really work with these independent sales reps. And these independent sales reps, you know, are powerful. It's a really good route, because the question is, you know, you've got multiple routes. Do you go through a distributor? Do you go through independent sales reps, or do you have a direct sales force? Each one of those has a different financial impact for your company, a different go-to-market strategy, a different control of your destiny. You know, and mostly of the time you do a hybrid, and then the contracting route has been, do you become the approved vendor? And that's a process on its own. You know, do you qualify? And I will tell you, the question boils down to is, do you have enough SKU for them to put you on a 40-page contract and spend 6 figures and 2 years to put you on contract? Or do you try and find a GPO, you know, that you can go through under a blanket where you don't have so much control over your pricing, but you can be under contract?
Yeah. Bobby, this may be a good time to talk about the platform. Now, you were originally an investor in Nin Health,
Yeah.
but you were also on the ground developing it. So you saw that need as an entrepreneur originally. Because of low volume that some of the products have, it is difficult to sell, and no one would look at you. So you developed a platform. So I'm curious if you can talk about the platform, put it sort of in perspective, and also tie it together with how do you use it along with the sales force? Because obviously the platform, just like, you know, if you put things on Amazon, they don't sell themselves. You have to push them. So a little bit of that would be, I think, interesting to everyone.
Laura, thank you. So after the last company, I went around visiting a lot of these healthcare providers, and we realized there is a problem that they have across, not just in the US, it's a global scenario, but let's talk about the US. The key aspect is, and this is pre-COVID, and now it's accelerated to COVID. Pre-COVID, there are 14 companies, 1/4, that control a $320 billion spend of medical devices. But in the US, there is 10,000 plus medical devices. So think about 14 that control the spend, but there's 10,000 plus medical devices. How does a healthcare system know that any one of those exists? Prior, they'd go to conferences, they'd have their entourage, but even at conferences, where would you sit? Would you be in the startup area at the corner? You know, where would you be in that conference? And when these healthcare systems come, they have a route, they have their entourage, they know where they're going to go, and hopefully they'll meet someone. The second aspect is magazines. Do they see it in magazines? You know, are they looking at Google searches? Or is it a recommendation from someone internally? The chances of a physician nowadays saying, look, I want you to look at a product, has reduced dramatically, just because, you know, liabilities and recalls and all of that. So that product, you know, but yet in your personal life, you can buy something off Amazon today. I mean, you know, you're confident about it, you see what happens. So what would happen was, the healthcare providers in the US was asked to help to streamline the system. And the streamlining of system is, how does the various decision makers in a hospital know that a product exists from a small, medium-sized company once when it's got 510K approval? And how can it be done on a proactive manner? So what happened was Nin Healthcare was formed. It came out of, I was given the torch in order to do this, but the idea came from the hospital, clinics, and surgery centers. And what they wanted was, first thing was a platform where they could access products in real time, products that had 510K approval. It could be small companies, and these were ones that were just getting out there that they needed to know that exist. This is a product-centric platform, not a brand-centric platform. This is to create a pipeline for those 10,000 companies that do not have the infrastructure, the investment, or the resources to try and get to these hospitals. And this is this platform, what it's able to do. So in real time, as a touch of a button, it knows these products exists. And as you guys, you know, some of you may know, when they look at products in the past, they're looking at so many products. They downsize it very quickly. Your differentiating factor gets lost. The reason why you're here gets lost. And all it boils down to is, okay, what's the cheapest products around the table? Well, here's a platform where now they look at what's the value, what's the differentiating factor, what is the clinical information, what's the training videos, what's the IFU, what's the 510K certificate, and they get all of that at a click of a button in one screen. So now when that information is transposed or when it's sent across various departments, they all see one level of the platform. Value analysis team, the physicians, the biomedical engineers, the difference committee, the analysts, they all get to see now the same set of information. And you can do that now by uploading and coming in real time. So pre-COVID, this is a product catalog, which is what it is. And that's the first part that they wanted to see. So the access.
Bobby, do you want me to paste the link to Nin Health? Okay,
sure.
So anyone can access, I will post it in the chat box.
Thank you. So what you're able to see, you can come on, and actually there'll be 2 versions that are going to be launched post-COVID. I'll quickly tell you about it. So now this gives you access. Very first thing. And why did I want access? For me, in my previous company, where investors are saying, well, do you have customers? Do you have anything? Well, you know what? Now I can go and access. I can even get, communication. I can get dialogue. I can now show to potential investors, even to ourselves, look, we've now got routes. We've now got access to customers. The second aspect being is communication. Great, you email someone, hey, you know what? They have a question. They come back. It takes 5 to 10 days for them to come back and get questions answered. So internally, when you email, if they don't know you, they'll go to your website, look at info app, look at 1-800. Eventually, when they get connected, it's 5 to 10 days for them to get connected and get your answers done. In our system, it's a platform. It's a communication platform. Now, granted, we represent the hospital, clinics, and surgery centers. Our mission is go out and find products that can give us better clinical, a differentiating factor, increase clinical benefit, increase patient safety, and be very competitive in terms of pricing, but also transparency in the layers of pricing. So that connectivity.
Yeah, what are the categories of products? And is anyone able to upload? What is the process of approval to be on the platform?
First thing you do, you go in, you click sign up. When you go sign up, you'll get notified with a username and password. You go in and you create a page. You upload PDFs, videos, information, texts, SKU numbers, and pricing. Once when it gets approved, it goes live and it gets pushed out to the healthcare providers and they're able to see it. When they see it, if they want to ask you a question, there's a communication module. It comes to either your customer service, it comes to your email, it comes to your phone. You can now have a dialogue real time between them, as much real time as you want. And then the third aspect of it being is that Nin Healthcare is also an approved vendor. So it's a diverse approved vendor. So now if they want to go ahead and purchase something, they will, if it's a large healthcare system, they'll contact you once when you guys have communicated directly. Your sales team can communicate directly. And this is basically a way for you to communicate. We don't sell your product. We provide you access to the customer. So either you or your sales team could go ahead and access them in real time, demonstrate the product, educate them on the product. And then at the same time, once when they want to approve it, we also have a contracting vehicle that you can use. It's an option. If you can get on contract, great. If you want to use our contracting vehicle, for us, we've demonstrated it takes no more than 60 days for us to put a product on contract for a large healthcare system. But also we have clinics and surgery centers and they can go on the platform and they just can click buy and you can drop ship to them directly. So we don't hold inventory. You deal with the customer, you communicate with the customer. We're a contracting vehicle. We handle the POs, we handle the invoice, and we give you the access.
So Bobby,
so that's where we were pre-COVID.
Mm-hmm. Yeah, you read my mind. I was going to ask you right now, what are you seeing on the ground? So I wanted to shift gears a little bit. You're also an investor. So when you look at the company that you're considering investing in, you're obviously analyzing their commercial potential. You're looking at the problem. You want to see proof that there's pain in the market, but you also want to see traction and a path to sales. So when you're looking at companies to invest in with your investor hat on, what are you looking for, or what are you recommending? If you see, for example, I know that for angel investors, if they see direct sales force as a go-to-market strategy, they get a little shy. They get scared. It costs a lot of money. You just talked about how much it is. Now, you are an intelligent investor. You know the space. So I was curious to see if you can answer how you evaluate their sales strategy.
So thank you. So right now, funds are available to invest, but the way I look at it is, what is the core competency of the company I'm looking at? And how do we use other platforms or areas on things which we can be smarter route to market? So the first thing I look at is the individual. And I will tell you, and I'll be granted, I'll put the first one, put my hands up. In the last 3 years, how I do due diligence on the company is a 180 to how I did it back in the old days. Back previously, I would ask for a certain set of forecast. I would do the due diligence on the company, and then I'd look at the individual. Today, I flip it around, and this is through experience. I look at the individual. Why are you doing this is the very first question that I will ask you. What is driving you to do this? And at the same time, what is the need that you saw? Who convinced you to do this? What is the product that you have? And the product that you developed, is this a product that can be used domestically? Is it a product that can be used globally? Is this something that I need to customize in every country? Why am I asking that? I want to know what your total addressable market is that you're looking to penetrate from this product. Now you have an MVP. What is the version 1, the version 2? Where are you looking at going at this? Is this a standalone product? Does it need to be sold in conjunction of? And then we look at the competitive analysis compared to the competitors out there. And I'm not talking about IP. I mean, patents, yeah, we have patent lawyers that can do that. But really about the product and about the individual, and what is it that you can do, and how much of it is a lift. So for example, if I take a product today, how is that going to help the workflow of the user of what they're using today? Because what you don't want to do, no one replaces anything overnight. And everyone wants to change healthcare, but I will tell you, healthcare doesn't change overnight. You have to crawl, before you can walk, before you can run. And what is that crawl step? And that's what I want to understand here. And that's very important. So first look at the product, then you look at the team that's coming behind this. And I will ask this direct question. The team that you have, you'll see people that have faces that are great faces, but how active are they? When's the last time you spoke to them? And what's the value that they have? For me, whenever I bring an advisor or someone to the company, I ask for a set of things. I ask for a Rolodex. I ask for knowledge from my team, help my team, elevate my team in terms of knowledge. I ask for either investment or sales channels, and those things that I ask, at least minimum 2 of those is what I require when they come on board. So does your team do that? When is the last time you engage with them? And those are the important factors in the hospitals or clinics or individuals. Who are those? And having conversations with those. So it really is hands-on down to the product level, because I will tell you everything else you can build. You can build manufacturing, you can build supply chain, you can bring HR, you can bring accounting, even now, go to market with NIN, your sales force or indirect sales force, you can bring those. But the products, which really is what this boils down to. So that's how I look at things right now. What's the cost analysis of this, competitive analysis? Is it a reimbursement model? Is it a cash paying model? How does it look, post-COVID now? How is this going to change and get to the hands of the post-COVID? And where does it fit in terms of what's occurring right now in a post-COVID supply chain scenario? Those are just in a snapshot. That's what I look at just in the first meeting. And my main thing is, which is what I like, is give me your 60-second pitch. And I will tell you, it's so important. If you write down words on a 60, I think it's 132 words. If you write that down, that's going to give you so much clarity in terms of what you're doing as an individual, as a company, and as a product. And I think that's very important before anyone comes, because there are meetings that at some point, within 3 minutes, 5 minutes into it, I still don't understand what they're doing. I still don't get it.
Well, trust me, sometimes it's 10 minutes, 15, and an hour goes by, and we can't figure out what the proposition is. Maybe now is the good time. Karen, do you see anyone? I don't know if we're able to see raised hands, but if anyone wanted to volunteer to give their pitch, I guess now that you put that right out there, Bobby, maybe we can have someone open their mic and have them pitch.
Sure.
Yes, we have one, Madi.
Yes.
Hi, Madi. Welcome.
Hi. This is Mahdi Madi from Toronto, Canada. Actually, we developed the first organic active agent based on chitin and some essential herbs. And this active agent can inhibit microorganism quickly, and also it can be used as a disinfectant and also antiseptic products. And also we incorporated it into the polymers and the textile in order to introduce self-sanitizing characteristics to polymers and also to the fabrics. And we already have done the in vitro test over the requirement of the FDA and also EPA. And we are also working to introduce the first antibacterial fabrics used for the healthcare centers in the US and in the Canada. And I want to somehow have the chance to give further information if you want. That's it.
Can we ask you a question? What would your sales process look like? Who's your customer, meaning who will be writing the check? What is your first beachhead who you will be going after at the beginning? So I'm talking about some serviceable, obtainable market.
For disinfectant, everybody, every household, every consumers can use it and replace it with the existing chemical-based disinfectant, because this is the only fully organic disinfectant and also antiseptic product. As you know, the current antiseptic and hand sanitizer, based on the FDA, no active agent has a GRAS definition, and we will be the first antiseptic hand sanitizer with the GRAS recognition by FDA. Mm-hmm. And also, it can be used on any healthcare system. As you see, the consumption of the hand sanitizers and antiseptics has skyrocketing in the COVID-19. They have all existing products have side effects in terms of the health and also in terms of the environment. Mm-hmm. So the need for introducing the new active agent with the minimum or without any side effect in health and environment is mandatory for the future.
Yeah, got it. Bobby, I know your answer, but I'm still going to ask. What do you, as an investor or someone who's an entrepreneur, think when the answer is every household or any hospital setting?
My idea, my thought process is, that go-to-market. What's your go-to-market strategy when you say every household? Being in every household name, I think, is great. The question is, how do you validate that? One thing I still didn't hear at the beginning of this is, I know what you've developed. I know how you've developed it. I know the contents of that development. But what made you go and develop this? And how do you see this being a differentiating factor to what's available today? I mean, that's my main question that I haven't heard the answer to yet.
Oh. Our main differentiation is that right now, the chitin has been used as a medical drug delivery system in nanoparticle systems. It means that it has very limited service life and shelf life of maximum 1 month, and also they cannot be incorporated in any manufacturing process over 100 degrees Celsius. But we develop our chitin active agent based on the microparticles, and we can incorporate into the different polymers and textiles in a process with over 200 degrees Celsius. So we
Got it.
introduced.
I want. Sorry, I'm going to interrupt you just for a sec because I want to direct it towards actually what Bobby asked. Differentiation doesn't mean what's under the hood. By explaining what the difference is on the nano scale does not help someone who's a purchasing decision maker understand why he would buy your product versus another product. It's more in terms of benefits. So again, that's very
Yes.
typical.
Consider that you have disinfectant with ingredients that all of those ingredients have been approved by FDA as a food additives. So it means that you have something that is very, very less side effect in terms of the health. And if you use it or if you somehow touch it, it won't impact your body.
So let me just add a point here. So, post COVID, and this will relate to you and to anyone else on the call. And as I mentioned, the way products being sold to market has changed. Everything's a burden right now. Your least path to resistance, multiple things. So, as you know, multiple hospitals, clinic, surgery centers everywhere set up task force. Right?
Yes.
There's a task force right now which just deals with masks and hand sanitizers. I mean, specifically, they have taken people away from contracting, from customer service, all of this. They're working 7 days a week. And I will tell you, masks and hand sanitizers, a team of 4 will get 120 inquiries a day of people looking to sell. Just to put it in perspective. Now, 120, that's just in one day. In that day, they need to get the information of the product, vendor information, the information of the company, pricing, specification. Now, can you imagine? Do you think that, how do they down select that? They can't down select that in one day. They just don't have the manpower, right?
Yeah. Let me give you better understanding about what we have done. Based on the FDA announcement, all the hand sanitizer in the market, over, let's say, 5,000 hand sanitizer, all of them have been using 3 types of the active agents, as alcohol-based, ethylene alcohol, and isopropyl and DZK. But these 3 approved active agents are not recognized by FDA as a safe, or GRAS, generally recognized as safe and effective. And FDA recommend and postpone and deferred that decision for 1 more year. What we claim that we developed the active agent based on the fully organic materials.
Yeah, I got it. So what I want to do, I just want to, just for the sake of everyone else as well, I get it. You've got this study, chitosan, great agent. Chitosan's actually used for gunshot wounds, yes, in bandages and all of that. So, it's great, doesn't cause heat. I think you're spot on with that. There's data around it to validate it. My key question here is, you've got a great product, right? I mean, that's what it sounds like. You're educating me. You're telling me I've got a great product. My question to you is, how are you going to educate the user that you exist, number 1? And number 2, how are you going to fight for time so they can read through all the material that you're going to send to them?
Okay. By incorporating that chitosan active agent into the polymers, plastics, and also to the fabric.
Sorry, I'm asking you a question differently. Sorry to interrupt you. I know you're talking about the product, but my question is today, yes, with that product, let's yes, pick a hospital. Let's pick a Kaiser. Would Kaiser be a customer to you, or CHOC or anybody, a hospital? Would they be a customer to you?
Yes.
Perfect. So my question to you today: how do you take your product? Number 1, who do you take it to in the hospital, and what's your path to take it to that person in the hospital?
Actually, we are in the communication with the FDA, and we need to apply for a couple of 510(k) application as a medical devices, and also apply for a special disinfectant for the healthcare environment. These are the application that we are working on it, and after approval of this products will be the first one in this category to be go into the market.
So good. So right now you're pre-approval phase. I got it.
Yeah.
So my question is, let's say you get approval tomorrow.
Yes.
What's your next step of taking that product to market?
That's a question that I don't have the full answer for it at the moment, but based on what I have, there is no fully organic product in the market, we can go over the online sales through the, let's say, Amazon on the similar ones, and also we can produce some unique.
So I understand, and sorry to interrupt. I totally get it. I mean, I know you've got something which is differentiating, etc. My key thing for you,
yes,
and I tell you what wakes me up every morning in my previous companies, even today, is what I don't know that someone else is doing. And the reason why I say that is because getting a great product, knowing what it does, is one aspect.
Yes.
Getting it into the hands of the people that need to hear and listen to this is another aspect. And post-COVID, it's changed drastically. And let me tell you how it's changed. So prior to this, great, you've got a product, you got 510K approval. You must really speak to some distributors. Hey, I've got a product, you know, you're going to fight for time. Maybe you go out, try and get some relationship with some doctors, get it into their hands. Maybe you find some independent sales reps. That's what would happen pre-COVID. And that's what's been happening for decades. Let me tell you what's happening post-COVID. What I told you was there are task force that are done. They don't have the time. They're overworked. They're stressed. They're on the front line. They don't have the time. Sometimes there is a term that goes out there which is called, we buy the best of the worst. Why? Because it's there today. They know it exists. It's not what they want to do. They have no choice but to do it. So the question is, how do they know you're there? So great. NIN Healthcare is one of those things, right? You can put your whole story on the platform. They can come and see it. Click of a button. You've got your screen. You've got your window. You've got your audience. But let me tell you what's coming down and what's coming towards the end of the year. What's coming towards the end of the year is actually a proactive system. And this is what we're working with healthcare systems in the US. Again, like I said, we represent them. And this is something for everyone to be aware of. There's a platform that we'll be launching. And when I say we're launching it on behalf of the healthcare providers. And what that's going to be is they are going to put out there for every company that's on the platform or anyone that comes up, again, sense, right? So you don't need to raise money to do this, right? You don't need to build a sales force. You could take your existing sales force, your existing 1099 sales reps, and you're giving them now leads and customers to go out and service for you. But what there will happen is they will put their requirements on the platform. I need hand sanitizer. This is the spec I need. This is the quantity. This is the price. This is the date. This is the key requirements. This is certification. This will go out into the ecosystem where companies like you and others are, and the companies that match that requirement will engage with them very quickly. What will that do? That will get rid of 120 calls a day, that noise that comes through on emails, phone calls, messaging. That will bring it down to really focus where they can really spend their time on quality products and start validating those. That's what's coming out in Q4 this year. And that's going to help your story, right? Because everyone has a story. Everyone believes in their product. But again, like I say, it's really got to find that path of getting to market and doing it now. COVID is about banding together. It's about getting your product out there, and it's about helping today. You know, this is not going away. So we need to see what we can do with our products. Every product can help, you know, and it's also bringing down the cost.
Karen, can I ask you if there are any other questions we wanted to answer? I know we only have 4 minutes time, so we wanted to be respectful of anyone else who had questions.
No, not right now. I have a few more minutes on this and then we can, let me see. There is one question. It says, hi, Bobby. Will your platform also serve health applications?
Correct. It's a product and service. So we're not tied to any device. So it's any medical device or any service that's provided, whether it be hardware, software, or human services.
Great. I think that's all the questions we have here. Any final remarks, Bobby and Lauren, as we're wrapping up this learning session today?
I guess that would be about the new ways of selling, Bobby. If you have any final thoughts on how things are changing, they're definitely changing. We're selling to different healthcare now.
It is, and what I will tell you is the problem we're facing in the US is a problem that's global right now, from a government sector and a hospital sector. So anything you have, definitely, digital is very important. Hardware is becoming software. Anything on the PPE is definitely a hot topic. So again, there is money out there. People are wanting to ensure that the story makes sense, that there's a go-to-market strategy, and that it's a global problem that you're addressing. So, I'm thankful that for everyone that's listening in on this and, that's really here to create value for patients, that's helping on the front line and helping all the workers, thank you for everything. And, I'm hoping we can all do our part and be safe.
And thank you, Bobby, for joining me today. It's always a pleasure, always fun. And I know
Thank you, Bobby.
It may not be the most cheerful of times, but we make it as fun as possible by hopefully showing some ways that there's some light at the end of the tunnel.
Laura, I just one last comment. I think from where we are, there's opportunities that come that weren't there before, and that's how we need to retool our business. Every business is retooling, and the question is, how are you retooling your business, even just a product? There's an opportunity there. This is not, we've dealt with SARS, we've dealt with Ebola. This is not going to be the last thing that's going to come. We're just going to learn to live with it. But how does your business really adapt? And that's the key aspect here. The ones that survive are going to do very well for the next 10 years.